There you go.
Okay.
Well, we are here in London in Leicester Square for the film premiere of First Do No Pharm, which is organised by Dr. Asim Malhotra. But here we have Dr. Sunil Dhand, who's currently working in the States. So great to see you in real person, Sunil.
John as well, it is great to meet you in real person. Very much looking forward to tonight.
We've done a few videos online, but it's always great to meet face to face. Why are you here? Why is this important? First Do No Pharm, bit of a strange name for a film.
Well, I think that a movie like this, a documentary like this, is very sorely needed. We are living in unprecedented times, as we talked about during our last interview together. We are facing a metabolic health catastrophe in the US and UK, and our whole medical paradigm is completely wrong. And documentaries like this help to raise awareness of the situation, and our pharmaceutical industry does not, unfortunately, exist for the benefits of the population, and more people need to wake up to this, need to wake up to what is going on to ultimately become healthier. And that's why we're all here, all of us who work in medicine in this field. We want people to be as healthy as possible. And I never could have imagined saying this as a student or as a young doctor, but I believe one of the biggest barriers to that is our pharmaceutical industry.
But if we don't use drugs to get people well who are sick, what do we do for them?
This is a very good question. And of course, you never want to throw the baby out with the bathwater as such. And I'm not by any means saying that all pharmaceutical products are bad, but the pendulum has swung so far the other way. To the point where I believe the pharmaceutical industry now, obviously it's the most dominant industry throughout countries, the USA more so than the UK, and there are some very good drugs out there, but now the paradigm is get people on as many medicines as possible earlier and earlier in life. We're seeing more and more sick people every year, and we need a complete rethink of this whole philosophy that the answer to our ills, whether they're physical or mental, is to simply drug more and more people up. Clearly, we're going the wrong way, and more people, as I said, need to wake up to this. So I'm not saying no medications by any stretch of the imaginations. There are some good meds out there, antibiotics, other life-saving pills and injections, but there are many which are clearly there to make a very profitable system and to keep generating recurrent income.
It almost sounds like you think people should be taking responsibility for their own health with their own lifestyle.
That's a great way to put it, John. Absolutely. Nothing beats that. Hippocrates knew it 2,500 years ago. This is not rocket science. I can show you publications from 100 years ago. If you got an illness like type 2 diabetes or even mild depression, you would have had a much better chance of receiving better advice than you do today, where that same person is going to be ridiculously medicated and they're going to keep getting sicker. I mean, ultimately, we're in this to get people better, but the current paradigm is medicating people and making more people sicker. Something is clearly not working.
So we need to think about our lifestyles as a whole, the exercise, social interactions, nutrition, eating the right food, avoiding the ultra-processed foods. Exactly. The whole package. We are holistic. Yeah. We are mind, body, spirit, and need to treat ourselves as such.
That's right. It's a complete package which is needed, a holistic package of wellness, and more people need to be thinking about that. And I think most people are yearning for that. It's that if you're not getting that advice on a consistent basis and all you're getting is more and more prescriptions, then obviously people are going to keep going down that route.
Now, have you got any prior knowledge of this film? Because I haven't seen it before. We were sort of... presumably you've had a preview being an important doctor, have you?
Oh, I wish I had. I maybe have seen a little snippets here and there, very, very brief. But no, I'm very much looking forward to a good night and learning a lot myself and carrying this message forward to more people.
Yeah. And hopefully we'll be doing some more videos with Dr. Dhand fairly soon, thinking about lifestyle interventions. And of course, don't change any medications without consulting your own doctor. But shall we report back at the end of the film?
I think so, yes. Thank you, John.
Yeah. Thank you very much. Thank you, Sunil.
Okay.
Press the red button.